Stephen. Thanks for having me here. I'm going to change the pace a little bit, unfortunately. I know it's the end of the day, but I am going to take exactly 17 minutes, so hopefully we'll actually catch up a little bit. Before I sell you the idea of precision public health, I need to unsell you another idea, and maybe you can help me do this a little bit, because this involves public participation a little bit. Who is interested in the truth here? Do you think there's actually a business case that you could make for selling the truth? Okay, so let's try agree that for biomedical medicine, one of the goals for biomedical medicine is to actually try to get as close as we can to nature's truth. Do we agree on that? So if we agree on that, can we agree on what is the language that we need to actually talk in order to actually get to nature's truth? Before you actually respond to that, I know we're going to have a long argument because people will say physics, chemistry, mathematics, or whatever. But can we at least agree that data is a necessary ingredient in order to get close to the truth? So if we agree that we're trying to get to the truth and we need data, can we also say that if we're going to start a business, we can actually make a lot of money by saying that we can start a company, and one of the first catches is that the business is going to make money because if anybody wants to research or do any work trying to get close to the truth, they will actually pay us and we'll share whatever they're going to discover with the rest of the world. And we don't have to do anything. They'll pay us, and we'll actually find other people who will review the work. We won't pay them either, but they'll do it for free because they're also competing to actually understand the truth as well. Do you think that's a good business plan? No? You don't think everything is free so far, so why is it not a good business plan? The third thing that we'll actually do is say that if you want to come with your work to us and we report it out for you, we'll actually make you pay for it as well. Does this sound familiar? It is. Because that's how things are set up right now. We're all competing for a piece of the truth. And we trip each other up so that nobody actually is going to get to the truth any faster than we're actually doing it. So in this confluence of influence, where we actually are tripping ourselves up and everybody's fighting hard, this publish or perish mindset is everywhere. Do we actually get close to being able to predict or even come up with solutions? No, it takes a very long time. So how do we actually disrupt this in order to actually solve problems that end up like this, where we have about 1 million children to 5 million children in Africa measured every single day of their lives. And then when that investigator gets tired of that project or can no longer get funding, guess what happens to that data? It ends up in those. I've actually gone into some U-hauls where the data looked exactly like that. And we try to retrieve it because we think that's actually important because the foundation actually paid for that data. But the investigator doesn't need it anymore. Or they might actually have the data scattered around on an old computer, or the postdoc who was in the group before and is sick of doing all this statistics, and he's the only statistician in the study, and this group is good at measuring stuff. They leave. Guess what happens to the data? It just gets thrown away. This is a waste, mainly because we also don't keep a history of all the failed studies that have ever been done. So we continuously are paying for ideas and studies that have already been tested by other people, but no one can actually report failed science, right? There's no journal of failed science out there. So all that information gets thrown out as well. And the foundation actually spends, our group has calculated this, probably around $600 million every year on things that we already know and should not be doing. That's not a good use of money. I'm going to make this more real. we were talking about precision beauty care earlier on, and Wenjun, I know, is he still here? He's disappeared?
Probably.
Okay, because I've talked to him on the phone once, and I was looking forward to meeting him. When we're talking about precision public health, I spent the last few days in Guangzhou at a maternal and child health hospital, joining the rounds that were being done in that hospital, because I don't know how many of you know, but the rate of children that are born with cardiovascular problems in China has gone up probably about threefold over the last 10 years or so. And also you're getting a lot more children that are born with mild to severe deformities. That number is also going up. So we're trying to figure out, can we actually learn what are the interactions that are causing those trends to keep going up, where in China, the rate of preterm is actually lower than in the US by about threefold. So the US in some areas is worse than a lot of the African countries, but in China it's actually getting much better. So we're trying to understand all these cases, and one of the cases that we're trying to understand is this idea of stunting. So stunting is being short for age. And we know that it's a key indicator of failure to thrive. So most children that actually don't have familial short stature, which means that you're just short because of being undernourished or because of exposure to different environmental insults, you end up with immediate and lifelong disadvantages. Most of the short for age children actually, depending on the setting, die very early, so within the first 60 days of life. Or they're going to have a high burden of disease. So 32% of children in the world born under 5 are stunted, which means about 275 million children are affected, and there's about 35 million deaths. So this is an important problem that we're working with. And I like to show this photo here. The parents with these kids, I know, they both went to Oxford, they live in the Gambia, but these kids, even though they live 200 meters apart and they actually eat and play together most of the time, they are about 10 centimeters difference. And that difference is actually going to keep growing over time. What is causing that? Both parents are educated at Oxford. They're eating very well. They're taking care of exactly the same way. And they also have exactly the same vaccines and everything else. Is it all genetic? Is it? Most likely not. Genetics is important, but not really. And if we go back to our science, to our publication history with all the papers that are generated from work over the last 15 years, because somebody working on nutrition, every time they publish a paper, guess what they think is going to be most important around growth stunting? Nutrition. If you're working in water, sanitation, and hygiene, it's water, sanitation, and hygiene. So by the end of 15 years, we think everything is important. So if you're trying to make money, or you're trying to spend money at the foundation and actually get the field moving forward, you don't know what to do. You look at this, everything is important, so you actually try. You end up being like a venture capital firm, right? Throwing your money around to everybody and hoping for the best. But that's not really how we want to do things. So going back to the data, we don't want to start off as if we don't know anything. We know a lot, because there's been a lot of data that's been generated. This is suggesting to us that actually we don't know anything at all, because everything is confusing. So can we actually go into the data and see if we can learn other things? And Bill is always saying to me, we should do machine learning. That's not the answer, right? We've actually tested machine learning against a lot of other methods that are out there. It so happens that when it comes to biology, you've got so many dimensions of within child variability, between child variability, you've got variability that's also changing with time. So if I take 10 children at birth and look at their heights, so I'm taking 10 children from Seattle and 10 children from Shenzhen. The within group variation is going to be about 50%. Between group variation is only going to be about 4%. So the two groups are more similar than the children within those groups are by themselves. Go forward 15 years, guess what happens? Between group variation remains around 4 to 6%, but within group variation actually explodes to about 80 to 120%. So over time, because genetics and epigenetics actually are interacting and a child is being exposed to all these different insults, we all start going in different directions. So trying to understand that heterogeneity, which is not what a lot of the machine learning programs are really aimed to be doing right now, because of all those dimensions of variation. And that's one of the challenges that we hope we're actually going to get to, is figure out ways that we can actually capture the variant structure that is underlying all these interactions in biology. And I think that's one of the challenges that's going to be important. So going back to our children, unfortunately what happens right now is that the hopes, wishes, and aspirations of the most vulnerable are protected, right? So we say we have to make sure that individuals are not identifiable in data. And what ends up happening is actually those people get completely forgotten, because a professor or an assistant professor gets their paper published and they move on. But these children, they were just measured and they actually never get to benefit from any of the work that's done. And I think that's absolutely wrong. So that needs to change right away. And this whole idea of the magic scientist, one person being able, or one group, one lab being able to solve this problem, really doesn't exist anymore. We want to actually get people who are the best at measuring things to be aligned with the people that are best at quantifying the data, not getting the lone person in the lab who says, I did statistics, I took one class in statistics, and they're the people who are analyzing the data in the lab. We want to get the best people who, across the whole stream of science within a certain domain, to be looking at this information, because that's how we're going to go forward and how we're going to go forward fast. And this idea of collaboration and competition, or collaboration, is really the way to go. So going back to our idea of those two kids, the other thing that happens in biomedical science is that you talk to two scientists who are working in exactly the same field. They actually measure innovation by coming up with different names for exactly the same thing. Engineers don't do that, right? If you have a resistor in China or Brazil or the US, the colors on the resistor mean exactly the same thing. But we don't do that in biomedical sciences. We actually need to change that. And one of the things that we're trying to do is bring the systems approach to biology, where we also looking at what I'm trying to show here is the variance structure, that we really trying to quantify the heterogeneity of effects of factors that drive growth and development outcomes. So what is the relationship between nutrition, water, sanitation, and hygiene, drugs, gut microbiome, and any insults that a child might have suffered over the life course. And obviously, when you think about the number of dimensions that are covered here, you end up needing to have millions of children measured here. And Wenjun was talking about wanting to actually identify yourself within the data set, which means you need to have been measured in order to be in that data set. We can actually borrow a lot of information across populations, because we are different, yes, but there's a lot of things that are similar. So there are fixed effects, or things that actually we commonly share, and then trying to understand random effects, or the things that cause variation, is really what is at the core of this, in order to provide this idea of personalized public health. And in order to do that, rather than needing billions of data points, now you need millions of children. And we have been collecting data, and now we have data sets from close to 50 million children who have been measured longitudinally. But we can also borrow information from cross-sectional studies, so the children that have only been measured once, and combine the data sets together. And doing that, we're around 300 million children worth of data that we're analyzing as a group. The team is global, and the whole idea that we're really sharing is that by using sensors and also using high-tech methods to actually see how children in low to mid-income countries respond to foods, or respond to learning, respond to affection for their parents. We can actually start using technology and data to see which things would lead to better outcomes in these children. So the idea that I just wanted to share with you is that we're thinking that there is a role for data collection, real-time data collection, looking at growth, development, and also this idea of the built environmental ecosystem, where you can actually look at the air quality, the water that the children are being exposed to, whether there's carbon monoxide or and how this actually interacts with the child's biomarkers over time, or biosignals is really going to be key. So my idea is that to get away from the journals actually running the way science is disseminated, is that we flood them with data, right? We want to flood everybody with as much data as possible, because then it's not going to be the lone statistician in the group that's actually doing the analysis. We can get other people to be involved and to help us get to this digital future where each person is providing data, and data is for the common good. One way we're doing this also is to have this life cycle approach, besides the engineering approach that I was just talking about. And by doing this, we hope to transition global health through data and technology to shared global wealth. So if you're interested in working with us, our team is still growing. We're looking for people who want to build for impact, who are fearless, who want to blaze the trail. We have a lot of data. You probably have a lot of good software and hardware that you don't actually have tough enough problems to work on. If you need a tough problem, this is one. And you're welcome to come and join the fight. Thank you very much.